It was 30 years ago that AIDS hit the headlines, and back then a diagnosis was generally a death sentence. Now, with the right medications, those with HIV/AIDS can live into old age, but caring for those individuals is not so easy. Enter Casey House. The downtown specialty hospital provides treatment, support, and palliative care for people affected by HIV/AIDS. It's launched a redevelopment project that promises better services for those living longer with HIV/AIDS. And for more information on that redevelopment and where the fight goes from here, we have the CEO of Casey House, Stephanie Karapita, on the line with us. Stephanie, good morning.
Good morning, Matt.
Tell us a bit about how the work that you have done at Casey House has changed in the years since that initial diagnosis was, as I said, often looked at as a death sentence for people.
Well, as we moved into, we opened in 1988, and as we moved into the 1990s, there was so many deaths happening. But by the mid-1990s, we started to, with the introduction of antiretroviral medications, we started to experience the concept of living with HIV and AIDS. And so we developed a home care program and outreach programs so that we could continue to provide wonderful care in our four walls, but also support the growing demand for care as people began to live with the disease.
Has the demographic of people that you're caring for changed as the disease and the fight against it has evolved?
Yes, it has. Today, Casey House cares for women. 25% of our care is with women, and the vast majority of our clients are isolated and marginalized and live in poverty.
Given the fact that people are living longer with this disease, what are the challenges that you find as an organization in matching your care with that changing and growing demographic?
Well, there's two. The first is that there are growing numbers of people with HIV, and that's because with the drugs, people are living longer, and also there's new infections every day in men, women, gay, straight, young, and old. The second issue is that the healthcare needs today of people living with AIDS are more complex than ever, and they're exacerbated by that aging. The people we care for at Casey House today are contending with, on average, 5 diseases layered upon their HIV diagnosis.
So within Casey House itself, what does that mean then in terms of treatment and in terms of care, but also just in terms of space and how you find space for those patients?
Well, we just don't have the space we need for a day health program, which was identified some time ago as a strategy that would enable us to care for people who want to live at home, who struggle every day with this disease, living in isolation and poverty. And we're very fortunate that the government has agreed to fund that day health program once we have completed our redevelopment.
And so the redevelopment will look like what?
Well, we were very fortunate about 10 years ago to purchase an old house on Jarvis Street, one of the original mansions of Jarvis at the southeast corner of Jarvis and Isabella. And we're going to, that's an historically designated building that we're going to restore to its original grandeur and attach at the back of it a beautiful home-like healthcare building that will enable us to provide our inpatient care, our home care and outreach programming, and that day health program that I mentioned.
How is that going to benefit the individuals? So if you have somebody who is there who, as you say, is often coming from a marginalized low-income background, that expanded care will allow them what?
Well, it will allow an early connection to a team of nurses, social workers, and therapists, as well as, of course, a support network of other people living with HIV/AIDS. It will allow for early identification of mental and physical deterioration and early intervention. And that will decrease the need for visits to the emergency department and as well decrease the need for inpatient stays in acute care hospitals.
One of the things that's distinguished Casey House from other hospitals, and this is not to be a slight against other hospitals, but is that sense of compassion in its care and that sense of that community, the community that you mentioned, the fact that people would arrive and feel as though they were part of something larger and that larger blanket could help them along through this. Is that going to be possible to maintain as Casey House expands?
Oh, Matt, absolutely. You know, our founders, led by June Callwood, established that vision of compassion and excellence, and that guides us every single day in the work that our wonderful care team provides. And our board is dedicated to that, and we're just going to move forward with that vision of a place that's warm and beautiful and home-like, providing the care, the same care that our founders envisioned in 1988.
What do you think we need to be thinking about as a city as the population ages and that overall population includes those who are living longer with HIV/AIDS? I mean, we've been talking about what happened over the first 30 years. Where does this go in the next 15, 20 years?
Well, we don't always know that, but aging is a really big part of it. Today, a person with HIV in their 50s often has the body of someone in their 70s. And so we need to think a lot more about caring for people with many diagnoses, people who are aging, and to be flexible and nimble with a team of strong healthcare professionals who are dedicated and will meet the needs as they evolve.
You do important work. It's good to see that that work is going to be expanding. Stephanie, thank you so much.
Thanks, Matt.
Stephanie Karapita is the CEO of Casey House, talking about the Specialty Hospital's new redevelopment project. You can find more information on our website, cbc.ca/Metro Morning.